Hi there, my name is Maria and I'm a third year Orthoptics student at the University of Sheffield. Today I'm going to show you a glimpse into what life is like on placement. For the most recent placement, I went to Southampton to work at Southampton General Hospital. Here's how it went. So this is the flat I lived in for the duration of my placement. The NHS provides a reimbursement plan where they pay us back the money for travel and accommodation while on placement up to a limit of roughly £80 per night. We chose a place close to the hospital to make the mornings a little easier to wake up for. The flat was great, we had our own bedrooms and bathrooms and shared a kitchen space to eat and chill together. In the morning, I pack my bag for the day. I take my lunch, my water bottle, notebook, student ID and equipment, which includes my fixation toys for the children and my occluder, pen torch and Snellen stick. We would have a short walk to the bus stop and take a 10-minute bus ride to the hospital. We would set off around 8 AM to give us enough time to reach for our 8:30 start. The best thing about summer placement is the bright mornings and good weather, so we'd enjoy the scenery every morning. The bus dropped us right outside the hospital and then we'd have a minute walk to the Orthoptics clinic, enclosed in our own eye department building. Firstly, we'd go to the staff room and read our feedback from the previous day to make improvements and check our timetable for the week. Then we'd be called by the orthoptist and discuss the clinic for the day, whether that would be seeing adults or children. We saw patients every 25 minutes for children or 40 minutes for adults up until 12 PM. The hospital had a canteen where we would eat on some days if we hadn't brought lunch, and they had various options including vegetarian, vegan and halal. After lunch we returned to the clinic. Patients would come in either with reduced vision or strabismus, which is a turn in the eye, and I would perform tests on them, come up with a diagnosis and management plan, and discuss with the orthoptist who would be supervising. This meant I could reflect after every patient and ask questions about particularly interesting cases. Some days we would have to sit in with the consultants to see how our patients would be managed further, or sit in with professionals that could carry out further tests such as electrodiagnosis, as well as extended roles that orthoptists can train to do. This helped to understand what it's like to work as a team and see who else is involved in patient care in the eye clinic. After placement, we would take the bus to Lidl to do our food shop for the week. We would get essentials such as bread, milk, cheese, fruit and veg, and pasta ingredients as it's the easiest and quickest food to make. Of course, we can't forget the snacks and ice cream for movie nights. The city was always busy and we'd go out and explore on the weekends. There was a shopping mall, the port, museums and lots of parks to make the most of the weather. Of course, placement would be incomplete without working on assignments and revision. We had exams after this placement, so clinical practice really helped us to understand our theory. We would sit down together and make mind maps to cover content and highlight weak points. Coming towards the end of placement, we decided to step out of Southampton and explore Bournemouth. We took a 30-minute train ride over and explored the city. There were art auctions and bird conservatories. It wouldn't be a day out without ice cream, of course. We enjoyed the sun and relaxed on the beach. While placement is a time of learning and putting theory into practice, it's important to wind down and explore as we are sent all over the UK, so it's worth exploring and making the most of the time that you have.